Hello and good afternoon, everyone. This is Lindsay Gutierrez with Alpha Media, and I'm joining you guys this afternoon to visit with someone special from our community at Valeo Behavioral Healthcare. And today we're going to talk about something that's very important for our community too. So today we're going to talk to Brad Sloan, who is with Valeo Behavioral Healthcare. And Valeo offers so many amazing, awesome services. And today we're going to find out about another one, pretty awesome one. Hello, Brad. How are you?
I'm great. Thanks for having me, Lindsay.
Absolutely. I'm so glad you got to sneak away for a little bit to join us. And
I actually didn't sneak away. This is really nice because I'm sitting in my office.
Well, that's good. The beauty of virtual things now.
Yes. One of the benefits of the pandemic.
Yes.
That we've all learned how to do this.
I know. It's amazing. And, you can work in sweatpants if you need to.
Right.
Days. Well, thank you so much, like I said, for being here. So kind of tell us a little bit about, we see VRC detox program on the screen. What is VRC stand for?
Valeo Recovery Center. And we, for people that have been around for a while, we were originally known as SARP, which is the Substance Abuse Recovery Program. When we changed our name to Valeo as an agency, when the Shawnee County Mental Health Center became Valeo Behavioral Health, we also changed our name because we were part of that organization. And so we're Valeo Recovery Center, a division of Valeo Behavioral Health.
Perfect. So how long have you been there at Valeo Recovery Center, and kind of tell us a little bit about what you do there?
I'm fortunate enough to have been with the agency for 16 years now. My particular position as program manager is I manage our frontline staff in our both our residential treatment program and our detox program, and manage some contracts and things like that for the department, and those kinds of things. So
that's awesome.
That's kind of it in a nutshell. I'm a jack of all trades, master of none.
Well, hey, as long as you can fake it for a little
yeah, I suppose that's a good thing to have in any job that you might be in.
Oh yeah, absolutely, for sure.
Good thing is just suit up and show up.
That's right. Yeah, and you're doing good. You're helping the community. You're helping those that are in need too.
Yeah, absolutely.
So we can kind of talk about a little bit about all of the services that, Valeo Recovery Center offers, but also who can come there and get services from you guys.
Right. So we have 5 different levels of care. We have a social detox, a residential inpatient program, a reintegration program, which is awesome because it's a really good program for our clients that come to us that are homeless, because it extends the treatment stay and helps them to get reintegrated back into the community with stable housing. And we help them find stable housing, encourage them to find work and things like that. Then we have a intensive outpatient program, and then our aftercare program. Okay. If somebody was to move seamlessly through that continuum of care, what it would look like would be they would come to us through the social detox door. That's an on-demand service, so there's no pre-requirements as far as assessments that need to be completed or anything like that in order for them to access services. There are some criteria that they need to meet in order to be able to access those services, but we can figure that out when they contact us. Social detox lasts 3 to 5 days. During that time, they meet with a counselor, and the counselor completes an assessment. That assessment then helps to determine what the next level of care will be for that particular individual. Most people that come through detox are going to be good candidates for our residential treatment program. Okay. again, the client is involved in every part of the process. So if they choose not to engage in a residential treatment program, that's fine. That's their decision, but we can plug them in somewhere else so that they can continue to get services.
Absolutely. That's really awesome and so important, I feel like, especially now.
Yeah.
With
Yeah.
everything that's going on, everything that everybody's had to deal with too.
Yeah, it's been particularly rough these last couple of years for sure. You know, one of the things that we had to do here was we had to scale back a little bit over the last couple of years in order to meet the requirements of the, you know, of the some of the restrictions revolved around how many people you can have in an enclosed space and things like that. But the other part of that is too is because we continue to provide services for the last 2 years, our residential services. We wanted to minimize the risk of exposure as much as possible for that particular client population. You know, it has been difficult because we had to change the way that we operate. And a lot of the things that we were doing 2 years ago, we are just now beginning to start back up and get those things going again. I was just telling somebody the other day, it's real easy to stop stuff. You know, you pick a cutoff date and say, okay, this is it. And, you know, but what's difficult is when you need to restart those things because we have to do it in a timeline. If we try to do it all at once, it would be overwhelming. So.
Absolutely. Not only overwhelming for you guys, but also the patients and clients.
Yeah, absolutely.
And
we're real excited about what we've got coming up over the next couple of months because many of the services that all of the services that we put on hold as a result of the pandemic, we are now restarting over this timeline over the next couple of months. So by the middle towards the end of May, we're going to look very much like we did prior to all the health issues that we had, not only in our community, but across the world. So.
Oh yeah, absolutely. And that's super exciting. And we're excited to.
Yeah. We're real excited about it. We're real excited.
For sure. Well, kind of talk to us about the co-occurring disorders and why is that so important to identify?
Well, to give you a little bit of background, you know, 16 years ago when I started in this field, in this profession, you know, most of our clients did not have a co-occurring diagnosis. And what we mean by that is that they have an addiction diagnosis as well as a mental health diagnosis. So they're co-occurring diagnoses. So 16 years ago, you know, the largest majority of our clients, 80% of them that came through the facility had an addiction diagnosis, and the other, you know, with no co-occurring diagnosis that went with it. Maybe 20% did. Today, that's completely flip-flopped and reversed. There's a lot of different reasons for that. You know, one of them is our clinicians, our SUD clinicians, have gotten much better at diagnosing some of these other issues that are coming along. Also, in an agency our size, you know, we have the benefit of having a lot of mental health, specifically mental health services in our agency. So we get a lot of folks that are referred from those departments. The other thing is too is that I think that the drugs on the street have changed. You know, 25 years ago, you know, amphetamines. Even 30 years ago, amphetamines, a lot of those were still like pharmaceutically produced, and some of them still are. But the ones that you saw on the streets were pharmaceutically produced. And so you saw consistency in the product, so to speak. Today, with methamphetamine being the most abused drug out there, at least in our part of the world, you just never know what you're going to get.
Sure.
And these folks, these street level chemists, so to speak. They'll use whatever ingredients are going to produce a sellable product. The end user, so to speak, the person who's using these products just never knows what they're going to get. As a result, in the last 16 years, we've seen a lot of methamphetamine-induced psychoses, and the neurological damage that's done in a lot of these folks is unfortunately permanent. And so, yeah, once those things start to occur, it's difficult to stop or manage. And, in some cases, it's reversed, but in a lot of cases, it's permanent neurological damage that occurs.
Right. And you can't undo those.
No, you can't. No, you can't. So to get to today, our department has become very proficient at dealing with and treating people that have co-occurring disorders, because we understand that this is the issue that they face, that the person that comes to see us seeking services faces. We understand that this is the current state of drug use in our community and what's happening to people as a result of that.
Absolutely. Kind of talk to us about what are the signs for someone to be able to come and get help, or, to come and get treatment. What are those signs for someone like myself? If I have a loved one or someone that I know, what should I be looking for?
Well, first and foremost, there's a lot of different ways to answer that question, but first and foremost, regardless of what they might be abusing, whether it's street drugs, or it could be something that they've been prescribed, or alcohol, for example. Alcohol is legal, but when it becomes, an abuse issue, probably the first and foremost is behavioral changes in your loved one. Things that you just notice that aren't the same as they were 6 months ago, or a year ago. This could include swings in mood. Now, and that's not to say that when people have swings in mood that it's automatically something that you need to,
more consistent,
automatically jump to that conclusion of addiction issues. But mood swings, behavioral changes, loss of jobs, and the person that drinks, getting a DUI is a life altering experience. Anything that might be occurring in their life that would cause you concern, especially in regards to how they're interacting with their world, how they're functioning with their world, and that kind of thing. Those kinds of changes. We should all be concerned when a loved one makes changes like that. But those are signs that would indicate that there may be a drug addiction problem.
Sure, absolutely. So how would someone then be able to come in and get treatment? What does that process look like?
Well, there's a number of different ways. Fortunately here we have a number of different doorways that a person can enter through. So if they call us and they talk to VRC specifically, they could enter through our detox services. As I already said, that's an on-demand service. It's as simple as a phone call to our technician's desk. That phone number, I'll give it real quick, is 785-234-3448. And you simply call, and one of our technicians will answer the phone. They're going to ask you for some basic information, name, date of birth, those kinds of things, demographic information. But key to this process is it is a short assessment to see if the individual who's calling meets criteria for detox.
Okay.
Now, if detox is not something that you're concerned about, say somebody that calls and says, it's been a week since I've used, but I've got this problem and I don't want to start using again.
Mm-hmm.
Well, they've already obviously detoxed, so they wouldn't meet criteria for detox, but they may be a good candidate for treatment.
Mm-hmm.
So what we would do in that case is there's a couple of agencies or some agencies in the community that do assessments, but we would refer them to our admissions office to see if we could get them in to complete an assessment to help us determine how we should move forward with that individual.
Yeah. And I just love working with you guys because everybody that I've ever talked to, whether it was a family member or a friend, that everybody is just so knowledgeable to know what's the next step too. And so it's really nice from, the community side to know that I may not know exactly what someone needs, but you guys do. You're going to direct that too.
Yeah.
Really awesome.
We are so blessed here in Shawnee County to have an agency the size of Valeo and offering the number of services that we offer. Because if somebody does call our detox desk, but that's not really the service that they need, we can get them connected wherever they need to be connected in the agency. We also have right across the parking lot from me, we have our crisis services. And, so sometimes people enter through that doorway, where they know they're in crisis, but they're not real sure what the cause is.
Right.
And, if they enter through the crisis doors, they meet with an intake clinician. That clinician then determines that they have an addiction problem, or, then they can refer us directly to us. And, and we can start to work with them. So, we have it really good here in Shawnee County. Much better than many counties across the state, because we have so many services at our fingertips, so to speak, to deal with mental health and substance use issues.
Yeah, it's an awesome service that you guys provide.
Yeah, I love it here. I mean, people ask me, "Hey, aren't you getting kind of close to retirement?" And I'm like, "Yeah, but that's probably not going to happen until they make me leave."
Right. You love what you do.
They push me out the door on a gurney or something.
Right. Until then, you're going to keep showing up for work. And I think
right. I'll be that old guy that's pushing his walker down the hallway. Isn't that wonderful?
But
he's 90 years old and he's still here.
That's right. Well, that kind of leads me to my next question too, of what are you most proud of for the services, for the recovery center, all of that. What are you most proud of?
That's a difficult one to answer because there's so many things across the agency that I am proud of. Especially, over the last couple of years, we started the MAP trailer, the shower trailer and and all of that to help our homeless neighbors and all those things. But here in VRC, I'm most proud of the work that my staff and the counselors and everybody here does, because everybody's invested in what they're doing, and you see that when you work with these individuals on a daily basis. They're compassionate and caring and professional. These folks are dedicated to the work that they do, first and foremost. And they're truly invested in the clients that they serve. They care about the outcome. And that's probably the thing that I'm proudest of, to be able to connect myself with Valeo Recovery Center and with the agency as a whole. I believe that's very, very true. I can say without a doubt that the largest majority of the staff here at the agency are here because they want to be here. It's not just another job.
Right.
This is something that they want to do, and they want to help people.
Mm-hmm.
So.
And I love that there's so many of your, teammates that have gone through things. And so you're able to help through experience too.
Yeah.
And that's really awesome. And I really admired that.
Yeah. A lot of our staff in VRC, not all of them, because, a person doesn't necessarily have to be in recovery in order to be able to be compassionate and caring and want to help people. But a lot of our staff are in recovery themselves. Mm-hmm. And so they have a lot of their own experience to share and to rely on in helping folks, take those first tentative steps into recovery, whether it's recovery from substance use or recovery from mental health issues that they've been facing. But those first tentative steps, they really need somebody to walk alongside them, kind of show them the way.
Sure.
Because most of us, when we find ourselves in that position, we just don't know how to do things differently than what we've been doing.
Absolutely.
But we know that what we've been doing is not working for us. And so having somebody walk alongside them through those first few months, or maybe even a year, for some folks it's longer than that, is very, very important.
It is, definitely. It's critical. That's what they need to be.
Absolutely.
Too.
Absolutely.
So, well, thank you so much for taking the time this afternoon. Everybody, you're able to find out more information. Go to valeotopeka.org, find out not just about VRC, but about every other service that is offered as well. And then, Brad, are they okay to email you if they have questions on anything?
Yeah, they could email me, or the phone number that I've already given. They could call that desk for information. We also are. I'm sorry. Our crisis hotline. Our crisis hotline. That number is 785 233-3300. So folks can contact them there. I hope I've got that right, because my brain's a little foggy.
That's okay. I know we put you on the spot there, but they can find all those numbers and all the information on valeotopeka.org.
Yeah, absolutely. The website is another one. And then, of course, our main phone number is 785-233-1730. And they can access, that's the main kind of trunk that comes in as far as phone lines go.
Perfect.
And then they can navigate it from there. So
that's awesome. Well, again, thank you so much. Thank you to everybody for tuning in this afternoon and learning more about VRC with Valeo. And again, find out all of the amazing services that they offer as well. So thanks again, Brad, and we look forward to talking to you again soon.
Yeah, thank you, Lindsay. I appreciate it. Thank you for having me on.
Absolutely. Have a great afternoon, everybody.
All right.